Travel isn't just about destinations, it's about the people you meet, the cultures you immerse yourself in, the stories you carry home. I'm Relebogile Mabocha, and on my travel feature, I take you on a journey beyond the guidebook. Each week, I connect with fellow travelers, insiders, and storytellers to bring you the heart of every place. Whether it's a hidden gem right here in South Africa or a dream destination abroad. Join me as we travel through conversations, memories, and inspiration. Listen wherever you get your podcasts.
702
Health and Wellness.
So on our health and wellness feature this morning, we are discussing kidney health, right? Kidney, every swipe counts.
702
Health and Wellness.
So on our health and wellness feature this morning, we are discussing kidney health, right? Kidney illness that affects 10% of people across the world and up to 1 in 8 people in South Africa. And it's important for us to look at what we can do, how to manage it, if this is something that's affected you. In fact, data from the National Kidney Foundation suggests that up to 65% of kidney failure in South African adults is attributed to hypertension and up to 25% due to type 2 diabetes. So how cognizant are you of your kidney health? Have you ever had challenges with them? How have you managed that? You're welcome to join this conversation. You can call us or send us a WhatsApp voice note. The number to dial is 011-883-0702, or you can send a WhatsApp on 072-702-1702. Professor Malcolm Davies is the Deputy Chair at the National Kidney Foundation of South Africa. Professor Davies, thank you for making time for us. Good morning.
Good morning, Clement. Thank you for having us on.
Yeah, maybe let's start with maybe an explanation about why our kidneys are so vital to our overall health.
So an excellent place to start. The kidneys are the major route through which the body controls basically all of what we call homeostasis, which is in essence the sort of normal levels of everything in the bloodstream. The kidneys also are a major route through which the body controls fluid balance. They determine blood pressure. They also act as an endocrine organ, which is to say that they also have a role in producing hormones. So the kidneys overall help keep fluid in balance. They help keep acid-base in balance. They help keep electrolytes, so salts dissolved in the bloodstream, within normal ranges. They are a major route through which the body gets rid of toxins that we produce all the time as part of normal metabolism. They contribute to things like the production of red blood cells, to the activation of vitamin D, which is an important factor in overall bone health. So they basically are the major route through which the body maintains sort of normal levels and homeostasis.
So when kidneys then begin to fail, what are some of the first signs or symptoms that people might notice?
So one of the problems with kidney disease is that in the early stages, where we really want to make a diagnosis so that we can intervene and slow down the rate at which the kidneys deteriorate, the disease is largely asymptomatic. In other words, people don't actually have signs or symptoms. And another problem is that as the kidney disease worsens, the signs and symptoms that people might experience are fairly non-specific. That is to say that the signs and symptoms could be attributed to a variety of other diseases. And one of the problems also is that with the sort of like gradual deterioration in kidney function as the disease worsens, those signs and symptoms may develop slowly. And so it might be difficult for people to appreciate that they are actually manifesting these signs and symptoms, basically because the slow onset means that people might sort of like not be aware of the presence of these symptoms or the impact of them on their day-to-day health. But the sort of things that one might expect to see, especially once the kidneys are really badly damaged, as would be sort of appreciated from what we said earlier about the role of the kidneys in maintaining fluid balance. So swelling, especially swelling of the face, might point to specific types of kidney disease, but also swelling of the legs, general sort of tiredness, fatigability, altered taste in the mouth, particularly, for example, metallic taste. sometimes even altered sleep patterns, changes in appetite, weight loss, all of these kinds of signs and symptoms, which, as we said, are fairly non-specific, would potentially point towards quite significant underlying kidney disease.
And then, in as far as the common causes are concerned, what are some of those common causes of kidney disease here at home?
So, as you said in your introduction, things like high blood pressure and diabetes, especially type 2 diabetes, remain important causes of kidney disease in South Africa as they are elsewhere in the world. But one of the sort of like unique factors leading to kidney disease in our local context is, of course, our HIV epidemic. HIV itself, as well as some of the drugs that are sometimes used for the treatment of HIV, can contribute towards kidney disease. But really, one needs to think about kidney disease as a disease that can be, that certainly in South Africa, can or has a strong sort of genetic component as well as a socioeconomic component. And so what I mean by this is that there are certain genetic mutations that are quite prevalent in our local population, which can contribute to a sort of propensity towards kidney disease when other insults are added on top of that underlying genetic predisposition. And then really importantly in the local context is the sort of intergenerational effect of poverty as a legacy of our colonial and apartheid past. And what I mean by this is that if we think about the development of the baby in utero, so in the mother's womb, the way in which organs develop is dependent on the sort of maternal socioeconomic circumstances, in that if your mom comes from a poorer socioeconomic circumstance, the diet that she's likely to be on is likely to be sort of lower in protein that the developing baby needs in order to form organs normally. And so if your mom doesn't have access to adequate protein in her diet because she comes from poorer socioeconomic circumstances, then your kidneys are likely to develop poorer or underdevelop as you develop in utero. And that means that when you're born with a poorer functioning kidneys than other people, which then will predispose you towards kidney disease later in life. So it's a complex sort of interplay of the traditional diseases that are associated with kidney disease as well as genetics and socioeconomic factors in our local context.
So I imagine then like lifestyle and diet, for instance, play an important role in either contributing to or preventing those kidney challenges.
Yes, indeed. So one of the sort of significant problems or contributors to the progression of kidney disease is the sort of high salt diet that we are all on at the moment because of salt admixture into the foods that we buy every day and our reliance on sort of fast foods, etc., as well as the role of diet in leading to the development of type 2 diabetes. And that combination obviously brings forth those diseases which can contribute to kidney damage, as well as then accelerating damage to the kidneys, for example, through the development of obesity and high blood pressure from the salt intake.
Yeah. And when it comes to over-the-counter medication, what advice do you have for our listeners? I mean, some people, they rely on ibuprofen as the over-the-counter painkillers to perhaps deal with the kidney challenges. How risky are these when they're used frequently?
Yeah, so we certainly shouldn't be using ibuprofen, which belongs to a group of drugs that we call non-steroidal anti-inflammatories, for the kidneys, because these drugs are in fact toxic to the kidneys. The simple truth is that almost any drug can exert what we call a nephrotoxic effect. That's, in other words, the potential for the drug to damage the kidneys. But as you say, there are certain ones that are widely available that are perhaps more of a problem can be obtained over the counter. And certainly non-steroidals would be one of those drugs which has the potential to damage the kidneys. Quite frequently when I see patients, they will tell me that they only use the anti-inflammatories once or twice. But the fact of the matter is that whilst certainly a higher dose of anti-inflammatories over a longer period is more likely to cause kidney damage, there is the possibility that some people are just more sensitive to drugs like anti-inflammatories, and even 1 or 2 doses can be sufficient to cause significant damage to the kidney. So it's important that if you are going to use tablets that are known to have an effect on the kidneys, like anti-inflammatories, ibuprofen, as you say, it's important that you have your kidney function checked regularly, and that you should try and limit those drugs as much as possible to limit damage to the kidney.
Yeah. Well, I'm going to take a quick ad break, Professor Davies. It's 14 minutes before 12 o'clock. When we come back, I want to give the listeners an opportunity to maybe ask some questions. If you are dealing with kidney challenges, your loved one is, you want to know how to support them, lifestyle changes, diet, any question you have in as far as kidney health is concerned, you can give us a call or send us a WhatsApp voice note on 072 702 1702. The number to dial is 011 883 0702.
702.
Health and wellness.
9 minutes now before 12 o'clock. Let's go straight to your WhatsApps on 072 702 1702 as we wrap up our conversation about kidney health.
So my brother, recently we found out that his kidney is not functioning too well. He's on insulin, diabetic type 2. And just last week, he had a heart attack as well. So he has a lot of complications. And doctor says this is due to him being on insulin, so diabetics type 2. So I want to know, and his kidney is actually functioning very low. I think they said stage 3. I want to know at this moment, what can he do? What must he eat? Must he exercise, etc., to improve his kidney? And also a person that has a healthy kidney, living a normal life, what can we do to make sure that our kidney functions healthy throughout our life? So what foods should we be eating? What food should we not be eating? Is a physical lifestyle also very good for good kidney function, etc.? Thank you.
Great questions there. Professor Davies?
Okay, so maybe let's just start with the response that it's not the insulin which has caused the heart attack or the kidney disease. Certainly, listeners may be aware that usually type 2 diabetes is treated with oral medication, but there are certain conditions where we have to swap over to insulin depending on the response to oral medications. And indeed, for patients who are living with kidney disease, there are certain levels of kidney disease at which we do not use oral medications because of the risk of side effects. So I think we can just say that the insulin is probably not playing a role here. In terms of the broader and more important question, as you say, Clement, which is the role of lifestyle and exercise in treating kidney disease and in preventing kidney disease, well, let's say that obviously, as we alluded to earlier, a healthy lifestyle and healthy diet are important factors in treating diabetes, controlling blood pressure, preventing obesity, all of which are factors that can lead to kidney damage. So a normal, healthy lifestyle, low in salt, low in added sugar, and avoiding, obviously, high-fat diets that are known to be a risk for heart attack and stroke are all sort of like interventions that we should all be making in any case, as would be, for example, a lifestyle which involves exercise, combat obesity, etc. For people who are living with chronic kidney disease, so there are certain changes that you can make to the diet which may slow down the progression of kidney disease over time beyond those sorts of like routine changes to diet and healthy lifestyle that we should all be using regardless of whether or not we're living with kidney disease. So one of the things is, for example, a diet which depends more on plant-based protein as opposed to animal-based protein may help slow down the progression of kidney disease, just because the type of protein that's in your diet may contribute to acceleration of kidney damage over time. And then, yes, sort of exercise is really important, again, in kidney disease, not just in terms of limiting or treating obesity, but particularly in the case of the caller, for patients who had an MI, it would be important to exercise in order to maintain heart health, but obviously guided by the cardiologist, who would potentially probably advise the amount that's safe to exercise having had a recent MI. I think just by way of conclusion in this case to say that what the caller's question also illustrates is the important link between heart health and kidney disease, that the two go hand in hand, and any sort of intervention that we make should try and address both the risk of heart disease as well as the risk of kidney disease.
All right, Robert, you're calling from Johannesburg. Good morning.
Hello?
Hi, Robert. Go ahead.
I'd just like to know, I've been the caregiver of a person who was born HIV positive, not his fault. And he's now in his 20s, and he's been diagnosed with chronic kidney failure. My two questions, could the ARVs have caused this? And secondly, what is the waiting list for a donor?
Got it. Robert, thank you for that. Professor Davies, I've got like 30 seconds left, please, if you can respond to Robert's question.
So yes, certain ARVs can damage the kidneys. It's obviously hard to know in this case because HIV itself can lead to kidney damage. The waiting list for a donor, well, it depends on your blood group. It would take on average for a deceased donor something like 6 to 8 years on the waiting list for a kidney transplant.
Sure. Jeez, that's quite long. Can we wrap up with this quick WhatsApp voice note?
Hi there, this is Clint from Dunkeld West. I just wanted to find out with regards to CKD. I'm currently CKD stage 2. My EGFR is 62. I understand if I go below 60, it becomes stage 3 and so on and so forth. At what stage would one have to get dialysis? Thank you, doctor.
Thank you. Yeah. Professor Davies?
Okay, so great question. It ties into the previous two. So there are two types of kidney disease. Acute, where something has happened recently to the kidney. Recently means less than 3 months. We can often correct that and restore kidney function. Chronic, where the kidney disease is going on for more than 3 months and the damage is more or less permanent. In chronic kidney disease, there are 5 stages. It depends on the level of function, which is what the call is referring to by the EGFR. Stage 5 is a GFR of less than 15, and that is the stage routinely at which we think about dialysis and a kidney transplant.
Yeah, Professor Malcolm Davies, thank you for making time for us. He's the Deputy Chair at the National Kidney Foundation of South Africa and Professor of Nephrology at Wits University.